Hi, I am Melissa Jones, a neuropsychiatrist at the Mike Lee DeBicki VA Medical Center and assistant professor of psychiatry at Baylor College of Medicine in Houston, Texas. And on behalf of our team, I am pleased to present our article, Rates and Predictors of Rapid Eye Movement Sleep Behavior Disorder Symptoms in Post-9/11 Veterans. In this study, we consecutively administered a screening questionnaire for REM sleep behavior disorder, or RBD for short, to a cohort of previously deployed post-9/11 veterans enrolled in an ongoing study called Houston Tracks. We previously reported that a quarter of veterans in Houston Tracks say they act out their dreams at night, which is a clinical manifestation of RBD. Many of these veterans also have PTSD and TBI exposures, both of which have been linked to RBD in recent literature. And RBD is important to recognize as it is the strongest predictor of future Parkinson's disease risk, especially in older adults. And we were interested in how many veterans in Houston Tracks would screen positive on a validated questionnaire for RBD, the RBD Questionnaire Hong Kong, and whether measures of TBI, PTSD, and other known comorbidities associated with RBD were predictive of positive screens. And in total, we screened 119 Tracks patients with the RBD Questionnaire Hong Kong. Of note, the patients were on average in their late 30s and over 90% male. Nearly half met criteria for active PTSD, and 85% had at least one exposure to a TBI previously. 45% had known diagnoses of obstructive sleep apnea based on chart review. We found that 60% screened positive by exceeding the total cutoff score of at least 21, and 50% screened positive via a score of at least 8 points on a subset of items most specific for RBD. The strongest predictors of positive screens were measures of PTSD severity and especially previous TBI exposures. Of note, just over half of these patients had chart documentation of previous in-lab sleep studies at any point during their time in the VA healthcare system, but the predominant focus of these previous studies was to evaluate for sleep apnea and not for elevations of muscle tone during REM sleep, which is the polysomnographic correlate of RBD. In summary, the high rates of positive screens on the RBD Questionnaire Hong Kong were excessive, at least compared to previous estimates of the RBD prevalence in the community. While this questionnaire is not specific enough for RBD in the Tracks cohort, these findings do highlight the high rates of parasomnia symptoms and the great need for clinical and polysomnographic evaluations to determine which subset of these post-9/11 veterans have RBD and are most at risk of future neurodegeneration. Also, future studies are needed to investigate relationships linking TBI and PTSD to RBD symptoms. Thank you for your interest in the article and to the Tracks patients.